something in my heart just kept telling me something is wrong with her.
In my head, I'm like, well, there's no way it's going to be my kid. It's just going to be something small. I didn't think that she was going to be 1 in a billion.
In hopes they can help baby Clementine or someone else in need of a transplant.
She was about 2 weeks old when my mom was holding her, and she was like, "Do you ever think something's wrong with her?" And I just immediately started crying. I had had this sick gut feeling that my kid was dying, and I could not explain why I felt that way. So while we're in the emergency room that day, they ran a bunch of tests, and they told us that she just had acid reflux. He was like, "You know what, can I just check off the boxes and run a CBC blood test?" And as he was giving us our discharge papers, he came running back in. She had a hemoglobin of 3.2.
She has to be admitted immediately and needs an emergency transfusion.
So we rushed to the NICU at Children's Hospital of Pittsburgh, and they told us that she had, 3 genetic mutations. One of hers was this TLR8 gene mutation, and that she was a carrier of it, but it wouldn't affect her because she was a female, and that this is only a male genetic mutation. And he said, I think you need to seek second opinion. So we went to Philadelphia, and then that's when we met Dr. Warren.
I met Clementine when she was about 2 months old. I thought, something is going on here. So I'm going to call my friends over at WashU and just ask for their thoughts about this, because Dr. Cooper had recognized the syndrome, described these patients. Dr. Bednarski had personal experience transplanting patients with TLR8 in the past.
I knew right away this genetic change in TLR8 was causing Clementine's clinical problems.
On St. Patrick's Day of 2023, I got a life-changing phone call. That's when Julia Warren told us that Clementine had TLR8. And at that point, I was like, yes, I know. And she was like, no, Clementine's the first female in the world to have this mutation.
Clementine is the only female and one of only 9 other children diagnosed in the world. She's also one of 2 children to have it in every cell of their body.
TLR8 is a gene that is responsible for helping our immune system to recognize when there's an infection. And a few years ago, we initially discovered a small group of boys who had a change in this gene, and they all had increased inflammation, low blood cell counts, and problems with their bone marrow. And what we were able to discover in the lab is that this change in TLR8 leads to overactivation of this immune sensor.
Dr. Julia Warren had given me so much faith. And the words out of her mouth were, if this was my child, I would go see Jeff Bednarski.
Clementine was the second patient that I've ever seen with TLR8. So we take information and we take experience from how we treat other diseases that are similar, and we use that to try to guide how best to design the treatment for Clementine. She came here already. She was on blood transfusions. And then we also started her on an anti-inflammatory medication. Then the next step after that is to look for a stem cell donor for her. And once we have a donor identified, we can move forward with the stem cell transplant. So 2 weeks before that, we started all the chemotherapy to suppress her immune system and suppress her bone marrow.
Starting chemo on your not even 1-year-old baby is terrifying, but ultimately we're doing it because we want her to be alive.
In March, we first introduced you to a little girl named Clementine and her family's desperate search for a life-saving bone marrow transplant donor.
Since then, the baby girl from McCandless has had her transplant.
Up until like day 99, she was not engrafted, and we were worried that we were going to have to go back for a second transplant and do this whole process all over again.
But what a difference a day makes.
On day 100, she became fully engrafted.
This next year is going to be really crucial for her, and just making sure she stays healthy, she stays in isolation, her counts remain high, that she really just adheres to that new bone marrow and starts to function like a normal body. As of today, her bone marrow is 100% donor cell and free of all of that mutation.
This is like a normal belly here. Your spleen used to be this big. We had some scary times, some challenging, but we made it.
I didn't hear the bell. I literally just felt air finally leaving my body and taking that first breath that we are going to be okay.
And that bell is just a microcosm of just how everything has just come to fruition, and now she did it.
Washington University School of Medicine and St. Louis Children's Hospital certify that you, Clementine, have successfully completed treatment.
One of the privileges of working here at Washington University and St. Louis Children's Hospital are the tremendous resources that we have to be able to do this world-class research. We have a big advantage of having our Children's Foundation. Much of the original research with TLR8 was funded by the Children's Discovery Institute and the Children's Hospital Foundation, and that really allows us to do this type of discovery work rather than continuing to study very kind of established models. If we had never discovered the original patient with TLR8, Clementine's genetic change would have never been flagged on her genetic testing and she would have remained undiagnosed. You need to have funding for that.
We're helping these families understand what's wrong with their children and have hope that there's a day where they will live without that disease process. We can't do this work without you.
We wouldn't have driven 615 miles, for nothing. Like it's been incredible.
If it wasn't for the hospital, she wouldn't have made it. And I don't think we would have made it. There's no words that describe how thankful that we are for St. Louis Children's Hospital.